Welcome to SSM Health, St. Louis University Hospital. We're happy to have you as our newest members of the family here at St. Louis University.
Well, as soon as I heard about Versant, I knew I wanted to apply at SLU. Its reputation alone makes you want to come here.
They're building a new facility in about 4 years, so being a part of the ICU, I'll be able to experience that transition with the brand new equipment and everything. Very, very nice.
I chose the Versant program because being a brand new nurse, it's very scary. And that opportunity to go from school to still learning was just a nice little okay, I can do this.
The only way that any new graduate nurse can come into St. Louis University Hospital is through this program. It's a good way for the nurses to transition from school into real nursing life. It's 18 weeks immersion period. During those 18 weeks, we have a combination of clinicals, classes. They spend some time on the floor with their preceptors.
I don't think this is going to be easy. Nursing school wasn't easy, but I got through that.
This is about family. This is about teamwork. This is about living our values, respect for our patients and each other. Thank you again for choosing us. Our goal is to make this somewhere that you want to come every day and work.
I can't wait to get on the floor and see what it's about. I'm a little nervous, but mostly excited.
I am very excited to get started.
Initially, when they're sitting through class, they're like, why do I have to sit through this class? I just got out of nursing school. Even though you have an understanding of it, you need to learn how do we do this at SLU? Because what you learned in nursing school is different than what we do at SLU.
The change from a student to an RN is a big change. You do things slower. You check everything that you're doing 2 or 3 times just to make sure that you're doing something correctly. It's a good transition from school, being in class all the time, to now being an RN.
I feel I'm much more comfortable now than I was originally coming into the Versant program. They offer about 5 weeks now of classes, refresh courses. We had our first week on the floor last week. That was an awesome experience.
I know for me personally, it was a little overwhelming, but I was overall excited just by the atmosphere. Everybody was willing to help, and there's just so much to learn. And just your first day with a patient, you can see what difference you make.
And in addition to the classes and working with our preceptors, there's supportive components to it to kind of help them adjust throughout that first year. There's debriefing and mentoring. And debriefing, we'll take the big group, we'll divide it into small groups. They can talk about whatever's on their mind in this group.
So in the debriefing sessions, we have a lead nurse who's been an experienced nurse, and either on the floor or in the ICUs, and we typically have a social worker in there as well. And so we typically talk about challenges that we face or the good things that have happened thus far, and then kind of bounce things off her about what we've experienced and if that's the norm, or if there's things that should be changed, or just adjustments we can make to our overall practice.
So it's nice just to get together with people who are experiencing the same thing and just have a good bench sesh with bagels and coffee. Lots of bagels and coffee, which I like.
It's exciting that I'm going to be done with the program, but at the same time, I'm going to be by myself. So that's going to be kind of nerve-wracking.
It's amazing how I'm like, okay, I have this, I need to set the bed this way, I need to grab these meds, I need this type of supplies, I need this camera and this for the doctor. And it's amazing how oh my God, I'm smart. I know my job now. But it's still a lot, I still have a long way to go. But it's slowly building, which I enjoy.
I just graduated from nursing school and then another 18 weeks. So I was like, it's going to be a little bit tough. But right now, when it's done, I'm actually, can we have another 18?
And it's surprising how far we've come, and it's only been 4 months. So I was like, wow, start from zero, and then someone sees that you're really fast at something. I was actually like, oh, yay, I'm learning something.
Honestly, it's probably one of the harder things I've done. Starting your career, it's always going to be difficult, but I'm happy with where I am right now, and hospital, it's been a good experience.
I feel like I've grown and evolved so much throughout this 18-week process. Coming onto the unit, I felt like I didn't know what to do, where to go, what to do first, and now it's just a natural flow. I walk into a room, I do prioritization, I touch my patient, I know what to talk with the doctors about. It all just flows naturally because I've found my own rhythm by shadowing other people and seeing what they do and learning what works for me.
I'm grateful for everything that SLU has done for me.